In this video, it gives me great pleasure to speak with you about natural ways to lower your blood pressure. When I see patients in my clinic, they are always asking about how to avoid medicines as much as possible and what they can do to naturally lower their blood pressure. So I'm going to cover the most natural ways to lower blood pressure with good clinical data to back it up. This will include information on which diet is best, which specific exercises are recommended for optimum results for heart health and weight loss, breathing techniques, 7 key micronutrients to consider, and other lifestyle changes. Do remember that the cornerstone of hypertension management, as I always say to my patients, is major lifestyle changes that are consistent, and the blood pressure will naturally lower as your body will respond to the positive changes you make. This will help gradually reduce the amount of medications you need to take. So let's get started with number 1, getting to the correct weight and waistline. Did you know that one of the biggest effects on helping lower blood pressure is weight loss? Blood pressure can reduce by about 1 millimeter of mercury with each kilogram, about 2.2 pounds of weight that's lost. Also, the size of the waistline is important. Carrying too much weight around the waist can increase the risk of high blood pressure. Men are at risk if their waist measurement is greater than 40 inches, that's 102 centimeters, and women are at risk if their weight measurement is greater than 35 inches, that's 89 centimeters. So this is definitely powerful and to consider when you're getting on the weighing scale in the morning. These numbers do vary among ethnic groups, so do ask your healthcare provider about a healthy waist measurement for you. Number 2, physical activity to help lower blood pressure. Did you know that regular physical activity can lower high blood pressure by about 5 to 8 millimeters of mercury? Being physically fit is associated with lower blood pressure and is definitely another natural way we can think about in our plan going forward. There's 2 different types of exercise that I recommend to my patients. The first is moderate aerobic physical activity, so essentially means a brisk walk or a light jog, and the guideline recommendations suggest at least 30 minutes a day or 150 minutes a week. The more you do, the better it is for your heart, but really at least a minimum of 150 minutes is how we should be, or how we should be trying to get on a weekly basis. Once you've achieved that amount of aerobic physical activity, another fantastic addition with a lot of data to back this way to lower blood pressure is with light resistance activities, so some light weights or some light bands, which can be very effective. The process is called the nitric oxide dump, whereby depleting oxygen in your muscles triggers nitric oxide release. Nitric oxide helps open up your blood vessels, which improves oxygen delivery and helps lower your blood pressure. The minimum I would recommend doing this is 2 to 3 times a week for 20 to 30 minutes. It's important because we know that as we age, we actually have to do more physical activity every year just to keep the muscle mass we have, and so this can be very helpful in terms of lowering blood pressure also. Number 3, dietary approaches to better blood pressure values. Did you know that eating a diet rich in whole grains, fruits, vegetables can lower your high blood pressure by up to 11 millimeters of mercury? Nutritional or dietary patterns are the most well-studied natural intervention for good blood pressure control. An introduction or the use of a diet called the DASH diet, which stands for Dietary Approaches to Stopping Hypertension, would be a good starting point. The information about this diet is widely available, and I recommend looking it up and start implementing it today. It's essentially a well-balanced diet with plenty of fruits and vegetables. It tends to lean more towards a Mediterranean dietary pattern and also includes sodium or salt restriction. This leads me to the next important point which is related, and that's number 4, correcting the sodium-potassium balance. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure by about 5 to 6 millimeters of mercury. So it's really powerful and a natural way to lower a person's blood pressure. It's also important to understand that when I talk about sodium, I'm talking about salt. All salt is equivalent in its effect, so sea salt is the same as table salt, is the same as Himalayan salt or pink salt. However, they are measured in slightly different ways. Different organizations have different recommendations of the daily intake of sodium. The American Heart Association recommends 1,500 milligrams of sodium intake a day, and the British Heart Foundation recommends daily sodium intake for adults should be less than 2,500 milligrams per day, so I would aim for somewhere in the middle. And potassium in the diet can lessen the effects of sodium on blood pressure, which means that if your potassium intake is too low, this can actually increase blood pressure. So it's important to make sure that you get plenty of potassium in your diet to correct the sodium-potassium balance. The best sources of our foods such as fruits and vegetables, and here are some examples, so I would pause the video for a closer look. Increasing potassium is more effective than simply reducing sodium. Aim for 3,500 milligrams to 5,000 milligrams of potassium a day, which might lower blood pressure by 4 to 5 millimeters of mercury. Ask your healthcare provider how much potassium you should have. The exception is if someone has other compelling reasons for a low potassium diet, like chronic kidney disease, which means our bodies ultimately hold on to potassium a little bit more than the normal individual. But in a person with normal kidneys, it's important that we're having plenty of fruits and vegetables and making sure our potassium levels are normal. Number 5, dietary nitrates. It has been shown in studies that another really important component to add to your diet are nitrates. Nitrates are vasodilators, which means that they cause your blood vessels to dilate or relax, and therefore reduce resistance within the blood vessel walls. This will lower your blood pressure and will allow your blood to flow more easily around your body. Some nitrates are taken regularly as medicines, and you may have been prescribed nitroglycerin or glycerol trinitrate or isosorbide mononitrate or dinitrate. Foods containing the highest nitrates are in beetroot, celery, cress, chervil, lettuce, spinach, and arugula or rocket. Number 6, alcohol. One of the things that we often think about in terms of elevating blood pressure is alcohol intake. In the US, limiting alcohol to less than 1 drink a day for women or 2 drinks a day for men can help lower blood pressure by about 4 millimeters of mercury. In the UK, the guidelines state drinking no more than 14 units per week to maintain a normal blood pressure. Number 7, getting regular sunlight. Did you know that blood pressure rises in the winter months? Studies have shown that getting regular sunlight may help, as significant nitric oxide is stored in the skin and the stores are mobilized by UVA light. This causes blood vessels to widen as the nitric oxide moves into the bloodstream and as a result helps lower your blood pressure. Number 8, breathing techniques. Studies have shown that breathing through your nose is better than breathing through your mouth. Nose breathing has been found to be helpful for lowering your blood pressure because inside your nose are paranasal sinuses continually producing nitric oxide which diffuse to the bronchi and lungs. This has the effect of widening your airways and blood vessels, which produces a blood pressure lowering effect. Number 9, sleep. Studies have shown that the quantity and timing of sleep is important in blood pressure control. Poor sleep quality, and I mean getting fewer than 6 hours of sleep every night for several weeks, can contribute to hypertension. Try making a change today by trying to stick to a sleep schedule. Go to bed and wake up the same time each day. Try to keep the same schedule on weeknights and on weekends. Create a restful space. That means keeping the sleeping space cool, quiet, and dark. Do something relaxing in the hour before bedtime, and that might include taking a warm bath or doing relaxation exercises. Avoid bright lights such as from a TV or computer screen or from a mobile phone. Watch what you eat and drink. Don't go to bed hungry or stuffed. Avoid large meals close to bedtime and limit or avoid nicotine, caffeine, and alcohol close to bedtime as well. And lastly, limit naps. For those who find napping during the day helpful, limiting naps to 30 minutes earlier in the day might help nighttime sleep. Number 10. Micronutrients for supporting healthy blood pressure. The following are some key micronutrients that I will list, but I will go into more detail with clinical data in my next video. It is important to remember that before starting any supplements, check with your healthcare provider if they are suitable to take with your current medication. The first one is coenzyme Q10, magnesium, EPA and DHA, also known as omega-3 polyunsaturated fatty acids, vitamin D, vitamin C, pycnogenol, garlic, and finally, other lifestyle interventions. Long-term emotional stress contributes to high blood pressure. This increases adrenaline and noradrenaline, which increases the heart rate. Caffeine-based drinks can increase blood pressure, so try and reduce them or stop them completely. Stop smoking, because smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve overall health, possibly leading to a longer life. So these are some natural ways to lower blood pressure without medication and help reduce your risk of heart disease. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. And please make a comment in the comment section to tell me what you've enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos on blood pressure medicines.